This is Sunekos Performa in a pre-mixed vial of 3.5 mils, and this is Sunekos 1200, which comes in two separate vials, one of the amino acids and one of the hyaluronic acids. One has to be injected into the other before treating, which will give you a total of 3 mils to inject. Once injected, gently roll the contents, do not shake, as it will create bubbles. I would typically roll for up to 1 minute to make sure they're thoroughly mixed. I will be showing in the video injecting Performa around the eyes, above the upper lip and in the mid-face. On the model's left-hand side, I will be injecting the Sunekos 1200. There are typically 4 points shown, but I'm also going to demonstrate 3 additional points you can use. One at the tail of the brow, one in front of the tragus, and one in front of the mandibular angle. But remember, you have a total of 1.5 mils on each side of the face. The white points are going to be the injection marks for the Performa. I'm demonstrating there 6 lines above the lip in 2 groups. So this is injecting the Sunekos 1200. 3 mil syringe, yellow 30 gauge needle. I'm injecting into the medium to deep dermis, and I'm injecting a total of 0.3 mils slowly. You'll see in the nasolabial fold 2 other marking points. I'm going to inject there with a cannula and injecting a bolus at each point. For this demonstration, I will be injecting 0.3 mils at each of those points. You could choose to inject 0.6 mils at one of those points, but remember you have a total of 1.5 mils to inject. So these 4 injection points are always used. Some people prefer a needle. For the upper 3 points, I prefer a cannula. You are immediately subdermal with the bevel up, and always injecting with the needle bevel up. It is not possible to get into the dermis itself with a cannula. Having done those 2 points and just gently pressing, I will use the cannula again to go up to the upper point, which is at the mid-pupillary line and mid-alar. I'm checking where I am and very superficially, and then injecting a bolus of 0.3 mils. This is an additional point at the tail of the brow, 0.3 mils. The other additional points are 2 centimeters in front of the tragus and just above the angle of the mandible. Always pressing any blood to reduce the risk of bruising. This is the Performa 1 mil syringe, medium to deep dermis, 0.1 mils at each point. This point I've just injected is midway between the center line and the line drawn from the oral commissure, and between the lower lip and the jawline. This point is at the upper alar cartilage and mid-pupillary line, again 0.1 mils. You can see 2 rows of 3 lines. They will be my next injection points, and they are running, as with all of the Performa injections, perpendicular to the Langer lines or tension lines. Note that I'm not injecting through the markings to avoid tattooing. At all of these points, 0.1 mils into the medium to deep dermis. You can see that these are relatively quick to do. I would only inject the 1200 and the Performa on the very first session. After that, it will be a session 2 weeks later of just Performa, and 2 weeks after that, another session of Performa. Another 0.1 mil in the submental region, again in the medium to deep dermis. These points are each 0.03 mils, but still medium to deep dermis. Around the eye for the static crow's feet, again 0.03 mils for each, injecting away from the eye.